Good morning, good afternoon. Thank you for joining us. We're going to give everyone about 2 minutes to get in from the waiting room. This is the Request for Applications, or RFA, webinar for the GusNIP Produce Prescription Program. Thank you again to everyone who is attending today. Just a reminder that this is the Request for Applications webinar for the GusNIP Produce Prescription Program. So if you're interested in applying for a produce prescription project, this is the webinar for you. If you have an interest that is more closely aligned to the Nutrition Incentive Program or the Training, Technical Assistance, Evaluation, Information Centers Program, we have more information available on those RFA webinars, and we're happy to connect you with those opportunities. Thank you for your patience as we've made sure that everyone has joined us from the waiting room. We're excited to have you with us this afternoon or this morning, wherever you're joining us from, and we'll go ahead and get started. My name is Mallory Koenings. Together with Dr. Pascal Jean, I provide co-leadership to the Gus Schumacher Nutrition Incentive Program portfolio, which we call GusNIP for short. We have many wonderful team members with us today who will be monitoring the chat. So feel free to enter your questions into the Zoom chat box as they arise. We'll be addressing them as they arise, and also we will have time to take questions before concluding this webinar. As most of you heard when you joined, this webinar is being recorded, and the recording will be posted on the GusNIP webinars webpage. The link is shown here for anyone who wishes to view it. If you want to revisit it for any key information, that's where it will be available. The slides will also be posted there. We want to make sure that everyone has the resources to USDA's non-discrimination statement and the resources that we provide to ensure that all of our programs are reaching all eligible participants. So please, if you have feedback to give us, do not hesitate to share it utilizing these resources. Next slide, please. I have the pleasure of opening this webinar. I am one of the many talented members of the GusNIP team. Also with us today, we have Dr. Pascal Jean, who will be in the chat, Mr. Ryan Kornegay, who will be presenting, Ms. Summer LaRose, who will be maintaining the chat, Ms. Beth Curling, who will be in the chat, Maria Crespo Champo, who will be presenting, and also individuals that are not pictured here who contribute to this program throughout the year. So all wonderful resources. And we also have with us our our technical assistance and evaluation team from the current GusNIP NTAE, also called the Nutrition Incentive Hub. So speaking today, we will have Rachel Ho, Paula Balbontine, and Patty Keene. Next slide, please. This is a slide that we will show one more time in this presentation. You are welcome to take a screenshot of it. This is the contact information. If you want to get in touch with the program staff, the grants management staff, if you want to reach out to the NTAE for more technical assistance or evaluation details, or if you might be interested in proposing a produce prescription project that could include a transaction of the Supplemental Nutrition Assistance Program. If that is an element that you're interested in, you need to be sure to reach out to the Food and Nutrition Service team to ensure alignment with all SNAP policy. And we're happy to help you make those connections. Next slide, please. This is showing the topics that we're going to be covering in our time together today. I'm going to go ahead and begin with an overview of the National Institute of Food and Agriculture. So we call ourselves NIFA for short. And what you're also seeing here, go ahead, you can advance, Ryan. What we're also showing here are some of the common acronyms and initialisms that we're going to use throughout this presentation. So the key function of NIFA, or the National Institute of Food and Agriculture, is as a grant-making agency, right? We are the extramural funding arm of USDA. Our goals are to, invest in advancements across research, education, and extension. And we do this on a number of topics. We're quite proud of the breadth of our portfolio, from soil health, plant health, animal health, to food and nutrition security and human health. Our grant programs cover a wide variety of topics. The GusNIP Produce Prescription Program that we're sharing with you today is in the food and nutrition security space. At this time, I'm going to go ahead and turn the presentation over to Mr. Ryan Kornegay, who will present the next section to you. Thank you.
Thank you, Dr. Candace. Greetings, everyone. I'm Ryan Kornegay. I serve as a program specialist for the Gus Schumacher Nutrition Incentive Program, for the Produce Prescription Program as well, specifically. So we're going to go ahead and talk about the RFA and the program overview. So just to kind of share some specific information, and you'll see in the top right-hand corner of these slides that this information can be referenced on these specific RFA pages. So what is new for FY 2023? This year is requiring all applicants to have a free 2023 RFA consultation of approximately 1 hour with the GusNIP NTAE, and to obtain a verification letter from the GusNIP NTAE. Also clarifies that all produce prescription projects must demonstrate and evaluate the impact of projects on the improvement of dietary health through increased consumption of fruits and vegetables, the reduction of individual and household food insecurity, and the reduction of healthcare use and associated costs. This RFA also provides additional guidance in the project narrative requirements and evaluation criteria. It further clarifies that the bibliography and references cited is a required document, and also further clarifies how to record total fresh fruit and vegetable prescription dollars in the budget justification. Lastly, it clarifies that the applicant organizations that meet the definition of eligible entity and healthcare partner may fulfill both roles in the grant application. So the produce prescription program, the purpose is basically looking at the intersection of the food and healthcare systems to improve the nutrition and health of participants, prescribe fresh fruits and vegetables. And as we talk about fresh fruits and vegetables specifically, this is identified in this RFA as any variety of fresh, whole, or cut fruits and vegetables. So the goals and objectives of the produce prescription program include to improve dietary health through increased consumption of fruits and vegetables, to reduce individual and household food insecurity, and lastly, to reduce healthcare use and associated costs. So as we talk about some of the priorities specifically for the produce prescription program, is looking to enhance and being able to help assist underrepresented communities, which include tribal communities, communities of color, LGBTQ plus communities, individuals with disabilities, veterans, rural and remote communities, insular areas, or residents under the federal poverty line. You also see in the RFA that it talks about underrepresented geographies. This includes Alabama, the state of Alabama, American Samoa, Arizona, the Commonwealth of the Northern Marianas Islands, Delaware, Federated States of Micronesia, Guam, Idaho, Maine, Maryland, Nebraska, Nevada, New Hampshire, North Dakota, Puerto Rico, Rhode Island, U.S. Virgin Islands, Utah, Vermont, Wisconsin, and Wyoming. So for eligibility, who are the eligible applicants for this program? Eligible applicants for the produce prescription program include nonprofit organizations and governmental agencies. Veterans Health Administration and various components of its healthcare system, such as hospitals or clinics, are eligible government agencies. Institutions of higher education that are local, county, tribal, territory, or state government agencies must provide documentation and support of eligibility as a government agency. So as Dr. Koenig shared earlier, we talked about the required healthcare partner, and every applicant must have a healthcare partner that is associated with this program. There are 4 categories of healthcare partners that can be identified, which include a hospital, a federally qualified health center, a hospital or clinic operated by the Secretary of Veterans Affairs, and lastly, a healthcare provider group. And as we shared earlier, as we talk about the required healthcare partners, a single organization can perform both of the primary applicant and the essential healthcare partner roles. As we talk about this a little bit more, first, all lead applicants should ensure that they meet the definition of an eligible entity as stated in the RFA, which is a governmental agency or nonprofit organization. And secondly, in order to satisfy health partner requirements, the applicant must ensure that the healthcare partner falls under one of the 4 categories, as I shared earlier, which is a hospital, a federally qualified healthcare center, a hospital or clinic that is operated by the Secretary of Veterans Affairs, or a healthcare provider group. And third, applicants must include a statement, which is a letter of support or a letter of support specifically from a healthcare partner, specifying the eligibility of the healthcare partner under one of the 4 categories. As long as these 3 requirements are met, the RFA does not preclude the healthcare partner from satisfying both the lead applicant, eligible entity, and the healthcare partner requirements. So some of the basics of the produce prescription program, as you'll see here, the program code is PPR. And so as you go through your application, make sure that you reference PPR when you see the program code. The maximum budget is up to $500,000 for a duration of up to 3 years. Projects must include prescribe fresh fruits and vegetables and evaluate fruit and vegetable intake and dietary health, food insecurity, as well as healthcare use and associated costs. So for the program area description, must include one of the following, which is providing financial or non-financial incentives for eligible individuals to purchase or procure fresh fruits and vegetables, provide educational resources on nutrition to eligible individuals, or establish additional accessible locations for eligible individuals to procure fresh fruits and vegetables. So as we talked about eligible individuals specifically in that last slide. What does that mean? Managing or at risk. So eligible individuals include those who are managing or at risk of developing a diet-related condition, and those that are either eligible for benefits under the Food and Nutrition Act of 2008, or those that enroll in medical assistance under a state plan or waiver of such a plan, which may be included like the Title 19 of the Social Security Act. The healthcare partner letter of support. Applicants must submit a letter of support from a healthcare partner, as we shared earlier, and the letter must explain the role of the organization, including any activities that the organization is expected to conduct in support of the project. This must include reference to potential participants, screen and verify eligibility for individuals to participate in a produce prescription project, track health outcomes and or reporting healthcare utilization and healthcare costs, provide educational opportunities relating to nutrition, communicate locations at which produce prescriptions may be redeemed, collect core participant level and firm level metrics, attest that your organization agrees to share information and core data with the Nutrition Incentive Program, training, technical assistance, evaluation, and information centers, or NTAE as we share, and evaluate individuals participating in a produce prescription project with respect to the impact of the project participation on the improvement of dietary health through increased consumption of fruits and vegetables, the reduction of individual and household food insecurity, and the reduction in healthcare use and associated costs. To now also bring back reference to the GusNIP NTAE consultation. As we shared earlier, a letter of support is required for this. All applicants are required to have a consultation session with the NTAE Center for a free one-on-one support and review, to review any common mistakes. To document completion of this consultation, all applicants must include a verification letter from the GusNIP NTAE Center in their proposal. And you'll be able to hear more information about that in a moment from our NTAE colleagues. And as we now want to share about the required comprehensive evaluation. So for this program, the Produce Prescription Program, you're required to participate in the comprehensive evaluation. You must collect a minimum core data set. You also must collaborate with the Nutrition Incentive Program, training, technical assistance, evaluation, and information centers into the NTAE colleagues. And also you must contribute a minimum core data set to the NTAE. And with that, I'm going to turn it back over to Dr. Koenig to share with us about application details and documents.
Thank you very much, Ryan. So as you are preparing your grant application, please know that you will need to have a unique entity identifier registered with sam.gov. If your organization already possesses a SAM registration and a unique entity identifier, that's wonderful, right? You've already achieved this step. If you are new to applying for federal grants, I recommend that you begin this step as soon as possible to ensure that your SAM registration and your UEI are thoroughly processed ahead of the application due date to relieve any stress on your part. Once you have this completed, you'll need to create a grants.gov account. Grants.gov is the portal through which grant applications are submitted to NIFA. It is the only form of electronic submission of applications that NIFA accepts. And please know that NIFA systems only allow PDF files, that is portable document format files, to be imported into our systems. So as you're building out your grant application in grants.gov, please do be mindful that everything you attach is in PDF format. Next slide, please. What I'm showing here are key required documents: the project narrative, bibliography, logic model, business plan, data management plan, and letters of support. These field numbers are the fields where all of these are attached to the forms that you'll find in grants.gov. The project narrative needs to be within 15 1.5 spaced pages using 12-point Times New Roman font. Within those 15 pages is where you can provide all written text, figures, and tables that convey the project you're proposing. In the cases of a proposal that has already been submitted to the produce prescription program and is being resubmitted, there is an opportunity for one additional page. Said differently, a 16th page that can accompany a resubmitted proposal. You can see the specific page limits for the logic model, the business plan, the data management plan, and the letters of support shown here. There's no page limitation, right, to the bibliography. The separate bibliography is to your benefit, right, to ensure that you're not losing any space in the project narrative in order to cite all of your references. And please, when you're pulling together your letters of support from all the key organizations included in the project, ensure that that letter of support from a healthcare partner, even if your organization may be performing the role of primary applicant and healthcare partner, you need to have that healthcare partner letter of support included, and that letter from the GusNIP NTAE that documents that you've completed the consultation. Next slide, please. These are the sections to include in the project narrative. Please, we do ensure that this key information, and really we do highly recommend these headings are used. It allows our reviewers to find the information quickly when they're doing their review. So please do utilize all of that information from the RFA when you're preparing your narrative. I'll also lift up that as you're planning the evaluation for the project you're proposing, Ryan already covered that there are key core metrics at the participant level and the firm level that need to be collected. You may also, right, go beyond those core metrics to best serve your community, right, your intended audiences, and achieve the goals of your project. Please do be sure that you're making it clear that you're meeting the comprehensive evaluation requirements. But no, you may also go beyond those. And I will also highlight here that these projects are really geared toward new or expanded activities. They're not meant to provide federal funds that are replacing local funds that would otherwise be supporting a produce prescription project. We like to share what NIFA's peer review process is for these grant applications. There is an initial screening to ensure that all administrative requirements are met. This is why, right, we are emphasizing so strongly that all files need to be in PDF format, that all of the page length requirements have been honored, that budgets don't exceed the dollar ceiling, right? That those required letters of support and required documents are all included in the application, because we want to make sure that as many proposals as possible can meet all of those administrative requirements and then proceed to peer review. And the peer review is conducted using the program area evaluation criteria in the RFA. And if you are from an organization that has received a grant from USDA or NIFA in the past, we'll also take into consideration compliance with grant requirements. Next slide, please. The flow of the peer review process is that there will be 3 reviewers assigned to provide an individual review of each proposal, taking a look at the strengths and weaknesses against those evaluation criteria. And these individual reviews are used to begin a panel discussion with the full peer review panel. And it's the full peer review panel that ultimately comes to a consensus on the technical merits of proposals and their final rating and ranking. Next slide, please. These are the evaluation criteria from the RFA. These exact evaluation criteria are what is provided to the peer reviewers for them to assess the proposals. So please take full advantage that all this information is shared within the RFA as you're preparing your proposals. Next slide, please. We do want to share, right, some common mistakes to avoid, right? So staying within the maximum budget that's allowed, right? And for this program, that's $500,000 total. That is the maximum budget allowed. Ensuring that the budget and budget justification are provided, right? There's many missing documents here, and any missing document can be a misstep, right? So again, making sure that that healthcare partner letter of support, that project narrative is present in PDF format, that the page limits are respected, right? That the bibliography is present, and that current and pending support documents and conflicts of interest documents are all provided. Next slide, please. We like to share what the typical peer review timeline is. So after proposal due dates, it does take about 5 to 6 months to complete the peer review process. So we recommend that you be mindful of that and be patient with us as we're working through the peer review process. We will continue to keep applicants apprised of the progress, right, of peer review, and you're welcome to reach out to us with questions. We do, of course, right, appreciate your patience and recognition that this is a 5 to 6 month process. And I will share that we recommend the start dates for applications be before the 30th of September 2023. Next slide, please. If you are applying to the GusNIP Produce Prescription Program, you're unable to serve as a reviewer. However, if you are interested in volunteering to serve as an expert peer reviewer across many of the other grant programs we have at NIFA, or you have, right, colleagues whom you would recommend, please do consider volunteering and serving the produce prescription community, the greater food and agriculture community in this capacity. We couldn't do what we do without our expert peer reviewers. So feel free to learn more about this. And we've provided this resource in the chat. And with that, I'm going to go ahead and pass the presentation off to Maria Crespo Cicerampo. Thank you.
Thank you, Mallory. Good afternoon, everyone. I'm a grants management specialist, and today I will be covering the administrative requirements. This will include pre-award requirements, indirect cost recovery, cost share or matching, budget and justification, and subaward restriction information. Next slide, please. So for certification of lobbying, submission of application in grants.gov includes certification of compliance to disclose lobbying activities. In the event lobbying activity takes place, an SFLLL disclosure of lobbying activities form is required. And you'll be able to find the link to this in our chat so that you can review that. Next slide, please. Prior to award, applicants must verify or re-verify financial management and internal controls in accordance with NIFA policy and uniform guidance 2 CFR 200.302 and 200.303. A single audit fulfills this requirement, a current single audit. Example documents when a single audit is unavailable includes 2 years of audited financial reports or certified year-end balance sheets, details of your cost accounting system, auditing arrangements, and salary compensation, a list of current or recent federal awards, and statement of purposes and powers, such as bylaws. Next slide, please. For indirect cost recovery, GusNIP allows for full recovery of indirect costs based on the current negotiated rate established by the cognizant federal agency. If there is no negotiated rate, you may 1, request negotiation from your cognizant agency, 2, request the 10% modified total direct cost, also known as the de minimis rate, or 3, waive indirect cost recovery. For more information on the indirect cost process, you may refer to this link, which will be posted in the webinar chat. Next slide, please. For the indirect cost recovery 10% de minimis rate option, an entity that does not have a current NIGRA or provisional rate and does not want to negotiate indirect costs may be eligible to elect a de minimis rate of 10% modified total direct costs, as defined in Uniform Guidance 2 CFR 200.414F. Once elected, the rate must be used consistently for all federal awards until the entity chooses to negotiate a rate, which the entity may request at any time. Again, for more information, you may refer to the link that was posted in the chat. Next slide, please. For the produce prescription program, there is no matching requirement. So therefore, NIFA will not factor in matching resources into the review process. Next slide, please. For budget and justification, this includes the research and related budget, fed only. Again, match is not required. A separate justification is required. If costs are deemed unallowable during the review process, this must be replaced during the award review. In other words, this would mean that costs may need to be reallocated to other sections within the budget. Next slide, please. So for FY 2023, what's new this year? Total fruit and vegetable prescription dollars must be summarized in the budget justification with clear affirmation of which budget category or categories were used to calculate totals. For example, a project design may necessitate produce prescriptions are included in section F.8, other direct costs, and section F.5, subawards / contractual costs. However, the budget justification should clearly describe that total fresh fruit and vegetable prescriptions are a sum of F.8 and the portion of F.5 specified as produce prescriptions. Next slide, please. So no more than 33% of the projects, as determined by the budget expenditures, may be subawarded without NIFA prior approval. Therefore, if pre-approval is desired, please contact the national program leader that oversees this program. Next slide, please. Only one GusNIP produce prescription program application per applicant organization is allowed. Again, this means that no duplicate or multiple submissions are allowed. NIFA will accept the last application received and disqualify previously submitted applications if an applicant submits duplicate or multiple submissions meeting the application deadline. Next slide, please. So these are going to be some links that will be posted in the chat for resources. And this is going to include frequently asked questions, application resources, and RFA webinars. Next slide, please. Additional grant resources will also be posted in the chat, and this will include funding opportunities, competitive grants flowchart, NIFA grant resources, NIFA policy guide, indirect costs, a guide for preparation and submission of NIFA applications via grants.gov, and information on awarded grants. This concludes my portion of this presentation, and I'd like to thank you for your time. Next, I would like to pass this forward to the NTAE speaker. Thank you.
Great. Hi, everybody. My name is Rachel Ho. I'm with the Nutrition Incentive Hub here at Fair Food Network, and I'm excited to introduce you all to the NTAE, the offerings that we have for RFA and application support, including the required consultation for your application, and also to introduce you to the reporting and evaluation team at Gretchen Swanson Center for Nutrition. I've probably met a lot of you already, but for those of you that don't know, I'm looking forward to meeting you soon. So next slide, please. Great. So the Nutrition Incentive Hub, we're a coalition of partners, and we're created by the Nutrition Incentive Program Training, Technical Assistance, Evaluation, Information Center, which here in this presentation on the RFA, you'll hear called the NTAE. And our role is really to support nutrition incentive and produce prescription projects during all stages of your grant project. So sort of the stage you're in right now, applying for a GusNIP grant, your ideation of your project, when you receive your grant, we're here to support you through that process. And also as you think about what's next after a GusNIP grant. So think of us as at the NTE, we are here, we are free support for you all throughout the life cycle of your GusNIP grant. And the objective of all of our programs is to strengthen access to fruits and vegetables. And a little bit about the history of GusNIP, as you may or may not know, it's funded through the 2018 Farm Bill, and GusNIP used to be called the Food Insecurity Nutrition Incentive Program, or FINI. Next slide, please. Great. So the work of the Nutrition Incentive Hub would be absolutely impossible to do without our coalition of partners across the country. So the GusNIP NTAE Center and the Nutrition Incentive Hub are led by the Gretchen Swanson Center for Nutrition, which is based in Nebraska, and they lead the reporting and evaluation related work. And our colleague Patty is going to tell us more about the reporting and evaluation offerings related to the GusNIP RFA in a few moments. My team that I represent, we're from Fair Food Network. We're a food systems nonprofit based in Michigan. And for both reporting and evaluation and technical assistance and innovation, we do our work through the partnership of many technical assistance experts throughout the country. So next slide, please. Great. So here's a quick introduction to some of our technical assistance partners, and I hope you get to meet all of them in your time with the Nutrition Incentive Hub. So the idea behind these technical assistance partners is they too offer 3 free support and resources in different topics of interest for GusNIP applicants and grantees. So we have our partners in Farm Direct, which is farmers markets, community-supported agriculture locations, and farm stands. You'll be working for this application very closely with our partners with the produce prescription grant. So Michigan Farmers Market Association, DIESA, and National Grocers Association. We also have some expertise in grocery retail, so grocery stores, corner stores, and whatnot. And finally, our corner stores and nutrition education partners at the Food Trust. So this is a quick overview of the partners and types of areas of topical support that we can offer you through the Nutrition Incentive Hub. Next slide, please. Great, so a little bit about our Technical Assistance and Innovation team, TA for short. So the goal of the TA team, Fair Food Network, and all of our partners is really to help you, as I said, ideate your program at all stages of your GusNIP grant. So we're here to help you resolve issues with your program. We're helping you to apply for the grant. And the way we do this is we have many offerings, which we'll share some links at the end of this presentation. We offer free resources, toolkits, very regular webinars and case studies. We have opportunities for you to get to know other programs in the field through our communities of practice. And we also have other opportunities, including our national convening in June, for you to get to know programs across the country around topics of interest. So really think of us as we are here to provide you with any types of information and connections you might need to run your program and to get to know other nutrition incentive and produce prescription projects across the country. So next slide, please. Great, so this is reiterating what I just talked about in the last slide. So when you think of the work of TA and I, we're to resolve issues, to grow the field, to build a community of practitioners, and to support you across the many different topics and needs you have as you work through your nutrition incentive or produce prescription project. And we do all of this with the help of our produce prescription partners at DIESA and Michigan Farmers Market Association and the National Grocers Association Foundation. So next slide, please. Wonderful. And now I'm going to pass this over to my teammate, Paola, who is leading our produce prescription application support at Fair Food Network. So take it away, Paola.
Thanks, Rachel. Hi, everyone. My name is Paola Valbonsen, and I'm the new produce prescription manager at the Nutrition Incentive Hub. I'm going to go over the details of how to request your one-on-one RFA support that is requested by this grant, as well as how to obtain your LOS or letter of support from the NTAE. So just as Rachel mentioned, we support project planning, interpreting the GusNIP RFA, evaluation questions, SNAP policy questions, and high-level application and administrative reviews. Next slide, please. Okay, here we go. So all applications are required to have a 1-hour consultation, an approximately an hour consultation with the GusNIP NTAE Centers Nutrition Incentive Hub. This can be met by attending 2 options. One is the topic-specific support sessions. We have a wide variety of different support sessions that you can sign up for. These are group sessions, up to 16 people. We have them once a week. And the second option is to schedule a one-on-one session with NTAE staff. If you think that you have a specific question that you don't think you can address through a group session, go for it, and we can schedule a one-on-one session. Also, throughout the grant application process, you're welcome to request more than one session. You can attend a group session, a one-on-one session, 2 group sessions, so we welcome your participation. Today's webinar does not count towards your required 1-hour consultation. That's important. Next slide, please. Okay, how to do it? It's easy. You have to email us at TA@Nutrition Incentive Hub. Please let us know if you're applying for a Nutrition Incentive Hub or a produce prescription grant. If you don't tell us in the first email, that's fine. That's the first question we're gonna ask you. So please let us know. And then also please let us know if you have evaluation related questions. We also have a team at Gretchen Swanson, Center for Nutrition for Evaluation, that they are supporting evaluation questions. And we also have group sessions for specific topics about evaluation. Yeah. Okay, so by the end of each meeting, if you attend a group session or if you attend a one-on-one, at the end of that meeting, we are going to share the link to request your letter of support. Next slide, please. Okay, this is important. Remember, you are responsible for scheduling an hour required consultation with the NTAE. If you reach out to us before the RFA was released, I encourage you to reach out to us again and request the information for the consultations and letter of support. By the end of each session, we are going to share the link to the letter of support. Important thing to notice is letters are processed every Friday. So if we take a couple of days, wait for us a little bit, we're going to be reaching out to you. And then the last thing, don't forget to include your letter in field 12 of your application. Your application will not pass NIFA's administrative review if you don't do that. And then, yeah, we are welcome. We're here to help. So please email us at TA@nutritionincentivehub.org if you have any questions or anything related to this RFA. And we wish you the best of luck. Next slide, please. Okay, as Rachel mentioned, we have a lot of resources on our website. We're going to post it on the chat. We invite you, we encourage you to go there. We have templates for letters of support. We have project narratives ready to go for you to look at them. We also have webinars and just a lot of resources for you to dig into. So we encourage you to do that. And then we also have information about our support sessions and the letter of verification. Next slide, please. And for those who are not part of our community yet, we have different ways for you to engage with the Nutrition Incentive Hub. You can subscribe to our newsletter and you will be receiving information about the RFA, but also, like Rachel mentioned, about our annual convenings. It's a great way to meet other people and learn from each other's projects. We also encourage you to join our discussion boards, communities of practice. We always have events and webinars for you to be aware of what's going on in your field and learn from others. So yeah, we invite you to engage with us and just shoot us an email for us to begin the process for the letter of support. Thank you very much.
Thank you, Paula. Can everybody hear me okay? Great. Good afternoon, everyone. My name is Patty Keene. Thank you for joining us today. I'm at the Gretchen Swanson Center for Nutrition and with the NTAE. So our overarching goal with reporting and evaluation, or R&E, as you'll hear and see it abbreviated, is to develop systems and collaborations that support grantees in meeting these R&E requirements while also building out sustainability and capacity. So in order to do this, we provide a number of core services, as you can see here on this slide. So one thing in particular to note is that each GusNIP grantee will be assigned a program advisor. That's my role, and there's many other program advisors within our shop who serve as a main point of contact to guide grantees through the R&E process, along with survey and reporting advisors to help you navigate the participant survey and the firm level reporting specifically. So some key tasks that we help grantees with include institutional review board, IRB, or human subjects protection, tailoring those core metrics for your particular project, analyzing aggregate results, and then also reporting to USDA and Congress and others. Next slide, please. So GusNIP requirements, on page 11 of this year's RFA, it outlines that all PPR applicants must have a consultation session with a representative from the NTAE to cover any questions and provide guidance, as our partners at Fair Food Network just outlined. This consultation session will result in a letter of support from the NTAE that is required as part of your application package. Next slide, please. Also on page 11, if we could go to the next slide. Thank you. So also on page 11 of this year's RFA, you will see this list of reporting and evaluation requirements for PPR projects. I know there's a lot on this slide, so we'll take a minute to go through this, but all PPR grantees are required to cooperate with the NTAE Center and USDA as needed. So this generally means that core firm and participant level data are reported, but it may also mean meeting with the NTAE or USDA to review your project plans or R&E specific protocols or providing documentation upon request. PPR grantees are also required to contribute to the core minimum data set. You've heard about this several times already today, and this includes firm level reporting and participant level surveying annually. And then lastly, to facilitate firm level reporting, grantees are required to have a data use agreement or an MOU with each firm or sub-grantee that guarantees each firm will provide the necessary information. Next slide, please. Page 19 in the RFA outlines a few additional R&E requirements for PPR projects. PPR projects are required to conduct a process assessment, and that documents the process, the challenges, and the successes of implementation and operations. A process evaluation might include tracking of milestones achieved along the way, or other simple metrics like checklists that monitor how your PPR project is implemented, were all the components delivered as intended, etc. We could spend a lot of time talking about what a self-assessment could be, but broadly, it looks at the implementation or the resources, the inputs and activities portions of the logic model rather than the outcomes. PPR projects are also required to participate in an outcome assessment that documents the project's effectiveness in improving dietary health through increased consumption of fruits and vegetables, reducing individual and household food insecurity, and reducing healthcare use and associated costs among eligible participants. And finally, PPR projects are required to have IRB review and approval. Next slide, please. Okay, I wanted to take a moment to describe the value and the reasoning behind the core metrics that you've likely read about in the RFA and hopefully explored a little further on our website. So demonstrating aggregate program impact of nutrition incentive and produce prescription projects contributes to the evidence that supports these programs. In turn, this has consequences for policy, funding, and overall program awareness. Having these common core metrics allows us to compare apples to apples and to really dissect what programmatic features work best under what conditions. The core metrics include both participant level data in the form of surveys and firm level data, that is data around site characteristics and incentive transactions. Both sets of the core metrics are derived from the legislative and the RFA language. And in developing the core metrics originally, we weighed these requirements by triangulating what grantees had proposed in their narratives, what programs have collected in the past, the scientific robustness of specific measures, including what's well tested in low-income populations, and then also considering grantee capacity. Next slide, please. So one of the key components of the comprehensive evaluation is conducted at the participant level in the form of a survey. So the PPR core survey consists of about 30 items with the main goal of measuring fruit and vegetable consumption and food insecurity, along with incentive program use, socio-demographics, and a few other items. So this survey is to be collected from the same participants at 2 time points, pre and post program. So we'll put a link in the chat box that describes the survey and also the rationale for each module in more detail. Next slide, please. So the number of surveys that are required from each grantee is based on the ability to detect a 1/4 cup per day difference in fruit and vegetable intake. So for produce prescription grantees, this means collecting 100 to 130 surveys from a subsample of your participants across the length of your award. So upon award, you'll be assigned a program advisor from the NTAE, and we'll work with your team on a one-on-one basis to finalize your sampling plan. Next slide, please. So let's talk about the healthcare outcomes. So the first two objectives of the GusNIP PPR program, so that's improving fruit and vegetable intake and food security, are assessed through the required core participant survey that's developed by the NTAE for all GusNIP PPR projects. So you will need to explain this in your proposal, but for the most part, you can check that requirement as covered for aims A and B. This leaves us with the third aim, so reduction of healthcare use and associated costs. Within the context of GusNIP evaluations, healthcare outcomes encompass 3 possible types of data: clinical health measures, healthcare utilization, and associated cost data. Depending on the experience and the capacity of the grantee or the partner healthcare organization and your individual PPR project goals, this aim can range from exploratory to really more robust impact analyses. Next slide, please. So this table shows an example of some health outcomes that have been proposed in the past and that may be of interest to you. So for example, projects that are working with populations diagnosed with diabetes, you may want to look at hemoglobin A1C. Other programs want to look at mental health outcomes, especially programs that have a social support component of their program. So these tables, and we have more on the next slide as well, provide some examples of things that PPR grantees have collected in the past. And Gretchen has put another link in the chat for our PPR healthcare outcomes of interest. Next slide, please. So every PPR application can look slightly different. So please contact us if you have any questions or need assistance on the healthcare measures to collect. The selection of which measures or measures to collect will usually depend on your particular PPR program eligibility, the outcomes that you think will change as a result of your particular program, and your organization or your partner's organizational outcomes of interest. Next slide. With healthcare utilization, some types of healthcare use are associated with improved health, like number of well visits, and that's called positive utilization, while others are associated with poorer health, like number of emergency room visits, and that's called negative utilization. So examples of these are included in this table. Can we go back one slide? Thank you. So there are some questions that should be answered to inform the selection of your healthcare outcomes and your measures. So this is aim C. So we suggest working with your clinic partner to answer these, since the clinic or healthcare partner, they will need the capacity, and not only the capacity, but the willingness to extract and share it with you. So this also may help with buy-in because you can elevate the outcomes that are important to your healthcare partner. So the first question is to find out what data your healthcare partner is willing and able to share. So this might depend on what is collected through their electronic health record or other data collection methods that they have. Then you will also want to consider which healthcare outcomes are of most interest to your healthcare partner, what types of healthcare utilization could change within the PPR timeframe as a result of a PPR, what outcomes make sense given the population you're serving. So for example, healthcare utilization will look different if the population that you serve is a pediatric population versus a maternal population, or if your program eligibility is disease specific. So lastly, the NTAE R&E team, we can help you identify appropriate measures and work through some of the logistics of data extraction and then also sharing with prospective grantees. Next slide. Okay, so firm level metrics, the last part of the evaluation are what we call firm level core metrics. So these are data that are reported from firms on a monthly basis and from the grantee and firms on an annual basis. So these data will be reported through the secure web-based portal on the Nutrition Incentive Hub. And again, we will put a link in the chat with more detailed information on these metrics. If you're a current GusNIP, GusERR, or an ARPA grantee or a former FINI grantee, these required metrics should look largely familiar to you. Next slide, please. So IRB requirements. So obtaining Institutional Review Board approval is the final component of the required evaluation. As all PPR grantees will be collecting data from human subjects via the survey, IRB is required for all PPR grantees. This does not need to happen as part of your GusNIP proposal, but it's a good thing to start thinking about, especially if you have never worked with an IRB before. The NTAE, we can help guide you in this process following award notification. And more information on IRB can be found at this link, which Gretchen is going to put in the chat for us. Next slide, please. Lastly, I just want to mention that the NTAE recommends adding a line item in your proposed budget for reporting and evaluation. So this might include IRB costs, an external evaluator, and data collection costs like participant stipends, among other costs. We do suggest planning for evaluation to be about 10% of your total budget, depending on the scope of your proposed project. We have a really good resource on our website to help you think through all the possible costs associated with reporting and evaluation, and that can really help with building your budget. And we'll link to that in the chat as well. And this is also a really good topic for a one-on-one consultation call with the NTA if you have any specific questions. Next slide. And one back. And in closing, so please, please, please feel free to reach out to either the TA&I or the R&E teams with any questions at these email addresses listed here, and then as well as check out our website at the Nutrition Incentive Hub for all the resources we talked through today, and there's many, many more there as well. Thank you so much, and I'll turn it back over.
Thank you very much. This is, again, right, a summary of the contact information for the NIFA program team and grants management team, and of course the NTAE as well. And we would love to take any questions that you all have, whether you'd like to enter those in the chat or raise your hand and come off mute and ask a question. I see a question in the chat of, is there a definition or guidelines for what the prescription must entail? Can it come from a dietitian, a nurse practitioner, a physician? Does it need to outline a specific quantity of produce? And all of those, right, members of the clinical team, right, the dietitian, the nurse practitioner, the physician, you could propose a project design where any of them would provide that produce prescription. The produce prescription does need to be well described in the proposal, and there is flexibility for project teams to really tailor that to the intended audience. So whether The team chooses to dose a produce prescription at the individual level, at the household level. If the prescription is in a dollar value of fresh fruits and vegetables or in a pounds of fresh fruits and vegetables, all of those flexibilities are available to project teams, as well as the duration, right, of that produce prescription. And I do see another question about evaluation and analysis services, if these are allowable costs. Yes, as you're putting together a proposal and the evaluation plan with your proposal, it is right acceptable that team member time and effort toward evaluation be part of what's proposed, or in some cases, right, perhaps partnering with a specific evaluation partner for those activities. Those are all relevant and possible options that you have available to you. Next question I see is, what does sustainability look like long term? And is there an option for extending past 3 years? So the proposals need to be for 3-year projects. That's the present scope in the produce prescription program. We too are very interested in what sustainability might look like long term, and that's why sustainability is a topic in the project narrative, as well as the evaluation criteria, and why that long-term business plan is a document that we ask for in the full grant application. So we do want everyone to be thinking about how a produce prescription project may become sustainable long-term as the application is being prepared. But right now, the context, right, of these grants is a maximum of a 3-year project. If we have a previous produce prescription grant that was a 1-year grant, can we coordinate our start date if we're going to apply for another 3-year term? I'll reiterate that all start dates need to be prior to September 30th, 2023. And if you are a previous awardee, please do be mindful about how a project that you might be proposing is really building upon or expanding prior work and not in any way duplicative of previous work. All right, question about how funds are divided across the 3 years. Are funds awarded all at once or a certain amount per year? So certainly in your grant application, right, you and your project team would determine how you might allocate, right, the $500,000 maximum budget across a 3-year project, and that's totally up to you. From just a logistical standpoint, for how NIFA makes these awards, we make these awards where all of the funds are provided all at once up front. These are when NIFA provides funds 1 year at a time. We call that a continuation mechanism or a continuation award. That is not how produce prescription awards work. All of the the funds, you know, for a meritorious proposal are awarded, pardon me, at once. Could you propose a 2-year project and utilize the $500,000 maximum rather than a 3-year project? Yes, you could. That is allowable.
Mary, can I add something to your previous comment? Yeah.
Yes.
Hi, everybody. This is Pascal. Just wanted to the question regarding, although you are awarded all at once, you will have to submit reports. So you want to make sure that you take out funds as you need it and provide information and be able to report on what you use. So we, I don't want to say discourage, we highly advise that you take the fund that you need and kind of report on it, especially on your progress report and on your annual financial report, so we know where you are and what is happening with the funds and the project. But you will have access to Mallory's point, you will have access to all the funds in the beginning and as needed. Yes, so I just wanted to make sure that's reiterate best practices to kind of move along as things are progressing. You take money that's needed and kind of make sure that the program is moving along as it should.
Maria, would you add additional information and clarity to that question from your perspective and your expertise?
Sure. So typically, I will agree with how Dr. Koenig's explained everything. And like Dr. Jean did also explain from the administrative perspective, if you are going to be utilizing funds, we just want to make sure that like with the reporting, that the reports will show that in something called an SF 425, which is a financial report. And that is something that you will learn about if you are chosen to be a NIFR grantee for this program. And if there are further questions, I'd be glad to answer that. You can send me an email, but I think that is general information. I don't want to add too much that might confuse the audience for today.
Thank you. So there's also a question about, right, how many applications are typically submitted to this program, right, and how many awards. So what is the typical success rate in produce prescription? I will say that this program has been experiencing a growth in applications over the past several years, about 30% growth a year. And we've been very blessed that like last year, there were additional funds available to support produce prescription projects. On the whole, the success rate in this program is averaging, between the growth and the plus ups, around a 50% success rate. And there's also a question here. Are there examples of what produce prescriptions look like? So certainly the links that we provide to previously funded projects and active produce prescription projects are a wonderful resource to get a good picture of what do GusNIP produce prescription projects tend to look like. And typically, right, the content of that fresh fruit and vegetable prescription is also something that the project team specifies. It's also something that's requested to be made clear in the grant application. if there are any other questions that come up as you're working on your proposals, please feel free to reach out to us, right, at NIFA, at the NTAE. We are here to support you, and we thank you for your time joining us this morning, this afternoon, this evening, and I hope that you reach out as needed. Any other closing thoughts or closing remarks from others, team? Okay, just one final reminder. We have recorded this, and the recording will be posted on the GusNIP webinars page. Thank you all so much.